Chapter 52, Assessment of Musculoskeletal Function Outline. Skeleton Superpowers, Support, Protection, Movement, and Minerals.
Med-Surg chapters are about 50 pages long, and half of the time you can tell what is important. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters. Assessment of musculoskeletal function outline, chapter 52 from Davis Advantage Medical Surgical of Nursing. This video explored the fundamental roles of human skeleton, including its crucial functions in support, protection, and movement. The often overlooked yet vital role of bones in mineral storage is also unveiled. This chapter covers the anatomy and physiology of the musculoskeletal system, bones, muscle, joints, ligaments, tendons, and fascia. The procedure for completing a history and physical assessment, relevant diagnostic examinations, and age-relating changes in musculoskeletal function. Let's talk about skeleton superpowers, which are support, protection, movement, minerals. This video explored the fundamental roles of the human skeleton, including its crucial functions in support, protection, and movement. The often overlooked yet vital role of bones in mineral storage is also unveiled. What if I told you your bones aren't just rigid sticks, but living, breathing powerhouse that literally control your entire body? Prepare to be shocked as we uncover the mind-blowing secret your skeleton holds beyond just standing tall and moving around. You will never look at your bones the same way again after discovering their most surprising hidden superpower. Imagine a built-in superhero tirelessly supporting you, shielding your most precious organs and orchestrating every single move you make. Now, what if I told you this hero also manages your body's mineral supply, acting as a crucial internal bank? Discover the incredible multi-phase superpower of your skeleton that are essential for your daily life. Let's talk about unseen architects, support, and structure. Imagine a tent without poles. That's us without bones. Well, we will explore how your skeleton acts as the body's internal scaffolding, resisting gravity, and keeping everything in place. From standing tall to intricate dances, discover how the vertebral column and leg bones bear incredible weight while maintaining flexibility. We will peek into the microarchitecture of bones, revealing how its unique compositions allows for both immense strength and surprising lightness. Let's talk about fortress of life, which is protection. Your skull isn't just a pretty face, it's a super tight helmet protecting your most vital organ, the brain. We will look in at its intricate design. Even ever wonder how your delicate heart and lungs survive daily bumps and trembles? The rib cage forms an impenetrable shield around those essential organs. Beyond the obvious, we will unveil how smaller bones protect crucial nerves and blood vessels, often unnoticed but vital for your well-being. Let's talk now the body's engine, movement unleashed. Bones don't move on their own. They are the levers and pullers of your body. We will visualize how muscles attach the bones, allowing for everything from a blink to a marathon. Joints are the unsung heroes of emotions. Discover the amazing variety of joint types, from the ball and socket of your shoulder to the hinge of your knee, enabling diverse movements. We will highlight how the coordinated efforts of the bones, muscle, and connective tissue allows for complex action, from writing your name to throwing a perfect spiral. Lastly, we'll talk about hidden vault, which are mineral storage and beyond. Your bones aren't just solid structure, they are dynamic storage facilities holding over 99% of your body's calcium and phosphorus. We will explain why it matters. Beyond structural support, we will reveal how bones actively regulate mineral levels in your bloodstream, impacting everything from nerve function to muscle contraction, and discover the surprising role bones play in blood cells production within the bone marrow, and often overlooked but absolutely valid function. Now let's go in detail, and we'll start with anatomy and physiology. Overview of anatomy and physiology. The anatomy and physiology section of chapter 52 provides an overview of the key components and functions of the musculoskeletal system. We have bones. The human skeleton consists of 206 bones that serve to support bony structure, protect organs, enable movement, and act as mineral reservoirs like calcium and phosphorus. Hormonal influences like parathyroid hormone, PTH, calcitonin, and vitamin D regulate bone growth and reabsorption. So the function of the bones, the 206, forms the body's framework, allowing the movement, protecting vital organs, producing blood cells, the hematopoietic tissue in red marrow, and serving as the reservoir for essential minerals like calcium and phosphorus. The structure, its tissue contains both living tissue, blood vessel, nerves, collagen, osteoblast for bone formation, and osteoclast for bone disruption, and non-living mineral salts. Types we have classified by shape as long like femur, short like carpals, flat at sternum, irregular vertebrae, and sesamoid bones is like patella. Composition is composed of dense, compact bone on the exterior and more open, spongy bone on the interior, which consists trabeculae and marrow, red for blood cell production and yellow for fat storage. So the hormonal influences, hormonal like estrogen, slow bone destruction like calcitonin and TSH inhibit osteoclast. Parathyroid hormone protects osteoblast, and growth hormone all influence bone growth and loss. So we have the microarchitecture composed of compact bone, dense exterior, and spongy bone interior with trabeculae and marrow. The growth, its two long bones have a diaphysis, the shaft, and epiphysis, the ends. The epiphyseal palate allows the growth in younger patients. We're moving to the muscles. The muscles, the body consists three types of muscles. We have number one, a skeletal muscle, strained and under conscious or voluntary control. It attaches to bone via tendon and responsible for body movement. For example, flexion, extension, adduction. Smooth muscle, non-striated and involuntary under the control of automatic nervous system. Found in the walls of hollow organs and blood vessels, like moving food throughout the esophagus. Cardiac muscles, highly specialized, striated, and capable of contracting without neural stimulation due to automaticity pacemaker, cell setting the rhythm, highly resistant to fatigue. Next, we have the fortress of life protection. Your skull is a super tough helmet protecting your most vital organ, the brain. The rib cage forms an impenetrable shield around the heart and lungs. The bursae, the fluid-filled sac, and hyaline cartilage, cushioning, protect joints and prevent friction. The body's engine, movement unleashed. We have the joints are the places of union between two or more bones, permitting mobility and providing mechanical support. We have classification by structure, non-synovial joints joined by fibrous tissue or cartilage, and are generally immovable, like skull sutures. Synovial joints fairly movable due to presence of lubricating synovial fluid within the joint cavity, like knee, elbow. The key components joints are covered with hyaline cartilage, cushioning and stress absorption, and nearby bursae, the fluid-filled sacs, acts as cushions to prevent friction. We have classification by function. So we have synarthrosis, little to no mobility. Amphiarthrosis, slight mobility. Diarthrosis, variety of movement, freely movable. So the next is the hidden vault, mineral storage and beyond. But before that, let's go back to ligaments, tendons, and fascia. So we need to talk about ligaments, fibrous connective tissue that connects bone to provide stability to the joint and prevent undesired movements. They are viscoelastic, can lengthen under tension. The tendons is fibrous connective tissue that connect muscle to bone or other structure to facilitate movement. Fascia, a layer of interconnected connective tissue that encloses, stabilizes, and separates muscle and internal organs. So the hidden vault, mineral storage and beyond, your bones are dynamic storage facilities holding over 99% of body calcium and phosphor. They actively regulate mineral levels in your bloodstream, impacting nerve and muscle function. Red marrow is the hematopoietic tissue responsible for blood cell production, red blood cells, white blood cells, platelets. Hormonal influences, estrogen, calcitonin, TSH, parathyroid hormone, all regulates bone growth and loss. The assessment, how do we check it? This section details the steps for a focus history and physical examination. Procedure for completing a history and physical assessment. The assessment process begins with obtaining a comprehensive patient history, followed by a detailed physical examination using inspection and palpation. So A, history of present illness and past medical history. Chief of complaint, ask for location, quality onset, and revealing worsening factors of pain. Associated symptoms, document the presence and degree of swallowing, stiffness, deformity, weakness, instability, loss of function, and alternate sensation, paresthesia. Past history, note any prior injuries, dislocations or conditions like hormonal issues and many impact the musculoskeletal system. So past medical history, make sure you collect past surgical, medical, and trauma history relevant to bones and joints, such as previous fracture, arthritis, osteoporosis, or falls. Falls are very important. So the history of present illness can be includes onset, location, duration, severity, and progression of musculoskeletal symptoms such as pain, swallowing, deformity, and loss of function. Now we go to the next assessment, physical assessment. We start with inspection. Look for symmetry, involuntary movement, deformity, swelling, edema, discoloration, and muscle bulk, hypertrophy, atrophy. Posture, assess proper body alignment and note abnormal spinal curvatures like lordosis and kyphosis. The gait, observe the patient walking, note if the walk is smooth, even, and well balanced with a symmetrical arm swinging. Palpation and let's look general look. Inspect for symmetry, we said, of movement, involuntary movement, deformity, swallowing, edema, discoloration, and muscle bulk. Then we have the muscle tone and strength. Palpate muscles, assess resistance and great strength. Sensation, check for numbness, tingling, or changes in sensitivity. Pulse assessment, evaluate circulation and perfusion distal to an injury. Then we have the palpation and specific test, muscle tone and strength. Tone, assess the normal degree of tension by gently moving the extremity through its full range of motion while the patient is relaxed, not a mild, even resistant. Strength, test strength by having the patient resist force. Strength is graded on 0 to 5 scale, 5 being full range of motion against resistance, which is considered normal. For joints mobility, range of motion, assess deliberate, accurate, smooth, and coordinated movement. Note if motion causes pain or discomfort. Goniometer can be used to precisely measure the angles of joint movement. The sensation, check for numbness or tingling, paresthesia, which may indicate nerve damage. Test the patient's ability to feel a stimulus, like using a pinprick test. Pulse assessment, assess peripheral pulses for rate, rhythm, depth, and symmetry to ensure adequate blood flow to the extremities, especially when injury is persists. Diagnostics, how do we see it? Chapter 52 details a variety of diagnostic studies used to assess the integrity and function of musculoskeletal skeletal system, which can be grouped into laboratory studies, imaging, and other procedures. The laboratory studies, those tests are crucial for evaluating the chemical composition that supports bone health, calcium, phosphorus, and vitamin D levels. Bones are the main source of calcium. Low levels of calcium or vitamin D are a primary indicator of increased fracture risk. Hormone levels, estrogen plays a role in stimulating bone forming cells, osteoblasts. A decrease in estrogen after menopause increases fracture risk. And just keep in mind the lab tests measure levels of calcium, phosphorus, and vitamin D, which are essential for bone health, and hormone levels like estrogen. And also we keep for creatine kinase and inflammatory markers. Those assist in diagnosing metabolic bone disease and muscle damage. The imaging studies, we have X-ray, provides basic image to find specific injuries or abdominal abnormalities such as fractures. We have the computed tomography, the CT scan, combines X-ray views for cross-sectional images and used to diagnose tumors and complex bone muscle disorders. Contrast may be used, requiring assessment for allergies and renal studies. So safety alert check for iodine allergies. Then we have the MRI. It's magnetic resonance imaging. Use a magnetic field and radio waves to create highly detailed pictures. It is essential for diagnostic for ligamentous tears, disc disease, and soft tissue issues. Require screening for metal objects like pacemaker and assessing for phobia, claustrophobia. So this MRI assess for soft tissue, disc, ligaments, and tumors. Require the patient to be on MPO for 8 hours pre-procedure. Next, we have the bone mineral density scan, DEXA, which evaluates bone density and osteoporosis risk using T and Z scores. So these assess the amount of calcium and minerals in the bone. It is the most common test to diagnose and monitor osteoporosis. Results are reported using the T-score comparison to a young adult. Then we have the bone scan. The bone scan, it's radioactive tracer is injected IV to find damage, disease, or trauma. Hotspot indicate high absorption, like healing, fracture, or infection, while cold spots indicate poor blood supply. detects metastatic bone disease or infection using an injected radioactive tracer. Electromyography, EMG. EMG assess the health of motor neurons and muscles by recording the electrical signal. It helps distinguish between nerve and muscle dysfunction. So this is measure electrical activity of muscle and nerves to diagnose neuromuscular disorders. We have arthroscopy. This is arthroscopic examination. It's actually in other diagnostic procedures, but it's a surgical procedure where an arthroscope, it's a scope, a camera, is inserted into a joint to view, diagnose, repair, or remove loose material. So minimal invasive procedure using a scope to visualize, diagnose, and treat joint disorders. The arthrocentesis, a clinical procedure where a needle is used to aspirate fluid from a joint. The fluid is analyzed to diagnose conditions like gout, arthritis, and inflammation like synovial infection. And keep in mind that with age-related changes, which include the downward hub, the thoracic kyphosis, which is this decrease in bone density. So a lot of elderly, they use DEXA scan to evaluate for T and Z score, especially after fractures. And then they recommend to have an injection as a medication every 6 months, or vitamin D every day, depends of the scores of DEXA. A physician will prescribe both of them, or just vitamin D or calcium. So that is more like in detail in medical management later on in the chapters. Age-related changes, the last part of our chapter. We have what happens over time. In this section, focus the gradual degenerative changes that occurs in the musculoskeletal system with advancing age. We have bone and joint changes. We have the decreased bone density. We have bone density begins to diminish after age of 30. Loss of accelerates significantly after menopause due to decreased estrogen. This loss markers bone thinners and more likely to fracture. Advanced loss, osteoporosis, can lead to a hump in the upper back called the Dowager hump. Joint and cartilage degeneration is joint cartilage decreases in mass and becomes thinner. Joints become stiffer and less flexible as fluid in the joint spaces often decreases. Calcification, it's a mineral deposit, may occur in and around some joints. Ligaments and tendons lose water content and become more rigid. Muscle loss and safety risk. Muscle loss, it's called also sarcopenia, which is a muscle fibers gradually decrease in size, number, and contractility, starting around age 30. The term for this decline in muscle mass and strength is sarcopenia. The loss of strength places more stress of the joints and significantly predispose older adults to arthritis and falling. 3. We have intervention to promote health. The chapter emphasizes nursing consideration and health promotion to maintain function and safety. Exercise. Regular weight-bearing exercise increases joint flexibility, muscle strength, and balance, helping to prevent falls. Supplementation, calcium and vitamin D. Supplementation are necessary to maintain bone mass. For prevention, crucial steps include reviewing medication for side effects like dizziness and drowsiness, getting yearly eye examination, completing a home safety review, removing tripping hazard, installing grab bars, especially on the stairs, if a house has stairs. Also take more bars in the bathrooms. Make sure the carpets or rugs, on the corners, they are typed or just remove. No cables around the house, just keep it floor empty. Then we go to the next. Age-related changes, key points focus. Those 4 changes significantly impact mobility, comfort, and safety for older adults. Decreased bone density and Donger hump. The bone density loss accelerate after age of 30, particularly post-menopause due to lower estrogen. Severe bone loss, osteoporosis, can lead to compression fracture and the characteristic forward curvature of the upper back, known as Danger's hump, is thoracic kyphosis. Sarcopenia is 2. Loss of muscle mass. Muscle fibers decrease in size and number starting around age 30, resulting in a decline in overall strength. The loss of strength is a primary cause of instability and increased fall risk. 3. Joint stiffness and rigidity. Joint cartilage decrease and ligaments, tendons lose water content, becoming more rigid. This reduces joint flexibility and contributes to pain and limited range of motion. 4. Increased risk and complication. The combination of those factors, weak bones, weak muscles, stiff joints, places older adults at a high risk for falls and any resulting factors, fractures, and slower and more complicated to heal. Nursing intervention to promote function is encourage regular weight-bearing exercise to maintain bone, muscle mass, and balance. Ensure adequate calcium and vitamin D intake. Assess and migrate fall risk via home safety reviews and medication check. This was a little summary of age-related changes. That's why I said key nursing focus. Now let's move to the last part. Here is the last part. I made top 10 quiz ready concept. This is me. Okay, so anatomy and physiology essentials. So this from anatomy and physiology part, I took 4 important elements, and from assessment and diagnostics another 6 elements, and I made it at the quiz ready concept. So bone cells and function, understand the primary functions, support protection, movement, and mineral storage like calcium, phosphorus. Know the key cells, osteoblasts build bone, and osteoclasts break down bones. Here there might be a situation in the book is very detailed, explain the pathophysiology, when they make and how they make it, and is a pathway. So make sure you don't confuse between osteoblast and osteoclast. Sometimes it's like very in all tests, exams, they ask a student to do, even if you are in anatomy and physiology class or you are in the nursing class, they will ask you about this. Muscle types, differentiate the 3 muscle types: skeletal, which is voluntary, striated; smooth is involuntary, non-striated; and cardiac, involuntary, striated, automaticity. Connective tissue, connection. Tendons connect muscle to bone, facilitate movement, and ligaments connect bone to bone, promote stability. Joint classification, know the most mobile types: synovial joints, fairly movable, contain synovial fluid for lubrication. In assessment and diagnostic part of the chapter, musculoskeletal history focus. The key components of the history are pain, location, quality, onset, and presence of swallowing, stiffness, deformity, loss of function, and paresthesia, numbness, tingling. Physical exam, aura. The assessment relies on inspection, posture, gaze, symmetry, swelling, and the second is palpation, muscle tone, strength, tenderness, pulses. It's very important to look for pulse. That means it's circulation. ABC. It's very important in nursing and medical field to know the ABC: airway, breathing, circulation. And here we have muscle strength grading. Know the scale. A score of 5 is normal for full range of motion and gets full resistance. A score of 0 out of 5 is 0, no contraction. Diagnostic test for osteoporosis, the primary non-invasive test to diagnose and monitor bone density loss, is the DEXA scan, bone mineral density study, which uses this score for interpretation. MRI safety, the crucial nursing implementation for magnetic resonance imaging, is screening for metal object, pacemaker, surgical clips, even if you have a necklace around the neck that or even piercing, abdominal or at the ear, just every metal object. Metal doesn't matter if it's metal, can be silver, can be copper, can be gold, needs to remove prior this MRI, unless a doctor says like, yes, even has this pacemaker, can do an MRI. There are specific ones, but the doctor will let know due to the powerful magnet. The last one, the age related changes. The main changes are decreased bone density, accelerated after menopause, and sarcopenia, decline in muscle mass and strength, which significantly increases the risk of falls. So here is the chapter ends. This is assessment. Now we're gonna move in more depth of diseases of this unit. So see you in the next one.
We finally made it!
Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.